Hello, everybody. Welcome to another episode. Today is going to be a tricky one, so bear with us because we've never interviewed as 4 people before. So Mags and I have got the lovely Alicia and Carolyn from Adelaide Pelvic Physios. And yeah, 4 of us here. Carolyn's a little bit poorly, so she's away in her home, in her PJs. So these lovely ladies are actually our pelvic floor physios. And they are known as pelvic floor physios. So introducing them, we'll start by what actually you do. And say hello to everyone. They've also never done a podcast before, so please bear with them and clap if you're all at home listening.
Hello, I'm Carolyn.
Hi, I'm Alicia. Nice to be here.
And Mags is here, of course.
Hello.
Talk.
So what do pelvic floor physios do?
Yeah.
So particularly pertaining to women, we will treat a variety of conditions. I think relating to what you guys do, we see women who are pregnant and after they've had their babies and assist with rehabilitating them. In particular, I suppose we, have a particular focus on their pelvic floor and their abdominal wall and rehabilitating that area. They might present with leakage problems, prolapse, which is descent of one or more of the pelvic organs coming down within the vagina or outside. They might have difficulty with their bowels. That could be difficulty emptying their bowels. It could be leakage from the back passage. It could be inability to hold in wind. It could be pain related to having had a tear from delivering their baby. They could have had a forceps delivery. Gosh, there's lots of things.
Oh, it sounds like you're just listing off me.
Yeah. And also particularly pain during sex.
Yeah, I think that's a big one. Not many people know that could be a pelvic floor issue, and they just think it's normal for their body.
Yeah, and not necessarily just after having a baby, but any time in their lives.
Yeah.
Any discomfort having intercourse.
On that note, I think, can people leak even if they haven't had babies?
Definitely.
Yeah, they can.
There's there's a few different reasons. It could be weak pelvic floor muscles, but not necessarily. It could be pelvic floor muscles that are not working well because they're overactive. And it could have more to do with their bladder function more than pelvic floor. So their bladder muscle might be overactive.
Yeah.
Sometimes underactive. So there's quite a few different combinations that could be going wrong in resulting in not being able to control the urine.
Yeah.
Well, they could have mechanical causes that they might have a hypermobility disorder. That means their fascia, like their tissue, is extra stretchy, and that means the urethra has greater mobility. So they're at increased risk of the mechanical cause of urinary leakage, which is stress urinary incontinence. So they don't just, birth or pregnancy and then mode of delivery are known risk factors for urinary leakage, but there are other things that can contribute to that, as Alicia has kind of touched on. I think, just going back to the original question of other things that we might see, we might see women after they've had before and after they've had gynecological surgery to support their repair and their recovery. We see kids and we see men too, but I know that's not what we're touching on today.
Because I heard a lot of girls that do dancing, like ballet, like anything that brings them, that they're sucking in, basically, that they end up with a lot of leakage. Is that true? Yeah.
It can be, but again, for different reasons. So I think it's less likely in the young pediatric population for them to have weak pelvic floor muscles. It's still possible, and possibly more so from what Carolyn was saying, from those connective tissue disorders. But I think more often in the pediatric population, it's an overactive bladder.
Right, okay.
That is predisposing them to more bladder leakage. And that can be something that they've had, you know, as a hereditary, a learned behaviour. So it's, a lot to look into. It could be, it could be excessive drinking. It could be holding on or postponing. It could be constipation. Constipation is a huge factor in pediatrics as well.
I bet the excessive drinking is quite a big one, because in the PT industry, you're always, people tell you, drink lots of water, you have to hydrate and hydrate.
Of water they were telling
And you're like, that's ridiculous. How can you can understand why you then have issues with pelvic floor, because how can you carry that on your pelvic floor and not have issues with leaking?
Exactly.
Yep.
And we're seeing young, fit women walking around with their huge drink bottles and doing lots and lots
it's
of
a fashion, isn't it?
Pilates.
It's just
But they grow now and they know how much they've drank during the day, and some of them are like a 2-3 liter bottles.
And the other thing too, which sort of links in with the endometriosis, which is really popular at the moment, is if a young girl especially has been having periods that are really painful, then that's going to set up a pathway for possibly more tension in the pelvic floor as well. And particularly, that can cause constipation, bladder problems, pain. So we're quite mindful of educating young women about periods and what's a normal level of period pain, and trying not to let them go down that path of overactive pelvic floor muscles.
And say back to kids, so you said you treat kids. I just have a client that her daughter has a lot of leakage problems, and I said to her, I actually don't know. So that's actually, I didn't realize you treat kids. So would they go to their doctor first to check things, or would they come straight to you?
I think it's always important that they exclude medical conditions that could be causative factors of leakage for children, most commonly urinary tract infection. But, they might want some investigations, some ultrasound of the kidneys to look at kidney function. So there's different investigations medically that need to kind of be excluded first. And then they could come and see us.
The other really important thing that we look at is bladder diaries. We get people to do bladder diaries, including kids, and especially what they produce urine-wise overnight. To weigh their pull-ups or weigh their bedding if they've been wet, so we can work out how much urine they're creating. Because sometimes it's got nothing to do with their pelvic floor.
And often it's not to do with their pelvic floor. It's bladder function or overproduction of urine at night time. It could be a poor arousal for the child, or there could be some underlying, as we said, bladder function. So it could be some underlying overactive bladder. But the bladder diary is really important because it allows us to look at how much urine they produce totally, how much urine they produce overnight, and there's a formula we can look at that allows us to work out if they're producing too much urine overnight by comparison to day. It allows us to look at their capacity of their bladder, which changes obviously as we get older, because obviously your bladder grows as we get bigger. And looking at bladder irritants, looking at their bowel. I feel like we've completely
we'll pull it back. I think this is really interesting because it's going to be important for mums who have their children going through taking their nappies off at night time, which is what I'm going through with Monty at the moment. And it's like sometimes they can revert and go back to wetting the bed 3 or 4 years later, and maybe that could be a thing that we need to go and look at with regards to their bladder.
Definitely. Always bowels.
With kids,
always bowels first. Constipation.
Okay.
Right. Think of the tiny space that their bladder and bowel sit in. If there's constipation taking up room and narrowing that space, then they're going to have less capacity to hold urine, possibly more urgency. It's a huge factor.
So what you're saying is you need to see someone like you two to understand, because this is what Mags and I do when we see a client. We generally recommend, have you seen a pelvic floor physio yet? Please go if you haven't.
Yeah.
Because like you were saying, obviously they're the inside scope. We can only see as much as we can from the outside when it comes to working their pelvic floor and working their core and doing all that rehab stuff.
Our eyes inside.
Eyes
I
inside.
like that too.
Yeah. And then I use my 2 fingers.
Yeah. She wants to do an internal, but she's not
I'm not
qualified.
qualified. I'm my school for practice.
As soon as Max brings her 2 fingers out, you're worried.
And all my clients laugh at me. I do it all the time.
It's visually though, isn't it? It's like, this is what happens. You need to check out, understand.
But back to kids, sorry, going back one step. I see with my son and all his friends, they're in school, right? They'll make a wee in the morning before we leave the house. He doesn't wee till he comes home in the evening. That's really bad. Or I says to him, why don't you make a wee? Mommy, I don't have time. And I'm like, and then he used the excuse, you're only allowed wee at recess and lunch.
Or they don't want to.
They don't want
feel
to, yeah.
comfortable in someone else's toilet, which is what I had with Monty.
Or sometimes there's teasing or bullying that happens in the toilets.
Yes.
Some of the girls I see, the young girls, they just think that toilets are disgusting from a hygiene point of view. But they often don't drink anything all day.
No,
because they're scared to go to
So
the
then
toilet and then they're
they come home
dehydrated.
and guzzle. And then they're often the ones that have trouble with the bedwetting at night because they're fluid overloading later in the day. They should be evenly drinking throughout the day and having regular wees during the day.
So should we encourage, like, I want you to do a wee at recess, I want you to try and do a wee at lunch, or then am I pushing him to make a wee?
Yeah, and is it bladder training in the wrong way? Like, I'm
Well,
confused with that too.
And that's where it comes down to the importance of bladder diaries. So otherwise we're blind as to what their bladder's functions like. We're only meeting someone for the first time. So technically, before we make certain recommendations, you look at their bladder diary, and they would have done that for 3 days beforehand, or some days. And then you get an idea, does this person have a really small bladder and we need to help them normalize it, or are they over distending their bladder? Are they postponing? And they need to be encouraged to void more often. So again, it's very individual. Depending on what you see in the bladder diary.
Okay.
So what do you do when you examine me inside?
Understanding the internal would be really helpful.
2 fingers.
And I guess why it's important to do it internal.
The 2 fingers.
I'll just very quickly say before I hand over to Kaz, just in terms of 2 fingers, we don't always use 2 fingers.
No, we don't. We don't.
That's why you're not doing it. That's why you don't need to do it. Understanding they might have experienced trauma as well. So some people may not be able to do an internal, that's still okay.
And even when they feel comfortable and the time's right, I would always say I'll just use 1 finger first, just to gauge their comfort levels. And then you get an idea.
Actually, I believe you did that with me. 1 finger.
Yeah.
It's important to share.
100%.
I think a lot of girls, when they first hear vaginal examination, they think speculum.
Like a smear test, which is
really
very
hard.
invasive.
Often make so I think it's really important to talk to them about what you're going to do exactly to put them at ease.
And going back to a smear test, could you ever do them? I hate when the doctors do them. They're so rough. And because I had trauma down there, I panic and I tense up and they reef my legs open. I sound terrible. Now, these girls don't do this. But I'm like, why can't a women's health physio do these? Because, I feel for me, I have to find a woman to do it. Like, I feel she connects better with me because they really hurt. So I think that's what people have the idea of the internal is. It's like that where it's actually a really gentle process when you do it.
But go for it, Carolyn.
Girls as well, just on that, Mags, to be able to prepare them for, say, a marina insertion or to have a speculum or vaginal examination, so that they can feel quite comfortable with that. So we actually can work with women for that process. We can, we can use a speculum, but it's important, I guess, that the reason for having a speculum examination is it exclusively for a smear test, because of course now you can actually go to the doctor and get the swab and actually do it yourself. Yeah. Or is it because you need the pelvic examination? Yeah. If only they show on the camera in the podcast.
I book in, say, with you guys for you to do the swab when I give it back to my doctor, because I'm due one and I'm petrified.
Yeah, so technically you're allowed to do it yourself. So you could take it and do it yourself at home. The reason why a speculum is used is to be able, if you think about what it is, it's a device that goes in the vagina and then they open things up so you can view those walls of the vagina and you can get the cervix into view, and look at that anatomy on the inside, because without that tool you can only see from the outside what you can only see. So the reason a speculum is used by the doctor for that examination is so they can view the cervix and then accurately swab that, scrape that area. Yeah. So what was the question?
Can you do a smear test at home?
Yeah. I think also, I think we have to be careful here that we recognise why it's going to be done, and not just a speculum.
Yeah.
So a smear test is just for cervical screening.
Yeah.
Whereas a speculum, in the gynecology field, it would be used for a lot of other reasons as well, not just for smear.
Yeah.
So, for example, a woman who's been using a pessary, they need to have a speculum at certain intervals to check all the walls of the vagina and the cervix up the top of the vagina to make sure there's no areas of abrasion. So
from the pessary, okay, so to carry on,
just to make sure
it,
that pessary is being used effectively and it's not causing any issues. So in that way, a speculum is important. So we can't say that speculums are no longer going to be used because we've now got these swabs for smears. It's just it is making, I think the swabs for smears are making it more readily available for women to, or make women feel more comfortable going to have a smear who would have otherwise been
avoided it.
Yeah. And I think that's important because you still need to be checked, but I can understand feeling very nervous about doing it.
Well, I had the where I got that fear was after having my first like a 4th-degree tear, all the malarkey that came with it. And she just, like, it was a lady nurse, and like I'd explained to her that I've had this child, and I was shaking because I hated everything to touch me. It wasn't even having sex or anything, and she just raved it up, and I remember her twisting and twisting and twisting the thing, and there was tears coming down my eyes, and she was like, "Do you want it done or don't you?" And
no, I don't.
And it wasn't in this country, it was in another country, and I was just like, oh my God, I never want to have one done again. And then I booked in with a lady, because you have to get them done every 3, isn't it? Every 3.
I can't remember. It's different in the UK.
And I said it to the lady, I've had, this horrible traumatic experience. Please, can we do this? Okay. And she was beautiful. She was really, really nice. But that still goes into my mind. And that the twisting of the thing was the hardest part ever. Yeah. And, I didn't even know what a 4th-degree tear was back then, so everything was sensitive. Yeah. And I think other women probably have that fear as well. I'm not the only one that has experienced a 4th-degree tear, there's loads of women out there. Yeah,
definitely. But it's important to bring it up.
Definitely. But yeah, back to what you do.
Not like that. Going through that internal, if you can explain it. Are you explaining, Carolyn, what actually happens in an internal exam to understand the pelvic floor? I think frozen.
She's frozen.
Yeah, I think she likes just holding that pose. It looks like
Are you there? Kaz, are you there?
speak no evil. Should we do the eyes and the ears? Well, Alicia, it's your turn.
That's her way of getting me to say.
Did it on purpose.
Okay, chime in anytime, Kaz. So doing an internal. So, I mean, I think it's very important to have a good chat and build a rapport with someone first. So that's why we have longer appointments. So you have a good chance to chat for a while, work out the problems, explain in detail what you want to do. So the woman has in her mind, she knows what's going to happen. First of all, we do a visual examination. So without even hands-on, we'll have a look at the perineum, just see what happens when she tries to contract and relax, and maybe ask her to cough and just see what happens with the pelvic floor just from the outside.
Just lost me.
She's back.
I'm back.
Alicia's answering for you.
I'm just talking about what we do with an internal, with a pelvic examination.
Did you start with the fact that we would educate around anatomy and then do a thorough consent process and all of that?
And that's why you're better.
That's not what you're doing. It's like she was just like going in with her two fingers.
I did say we have a chat first and we explain. But no, you go on, because that's important too.
Like, I think before anything, it's important that a woman actually understands her own anatomy. And so we would do a really thorough education around the pelvis and showing and touching, feeling, and then explaining that the only way we can really ascertain quantifiable and measurable components of pelvic floor function is through doing a palpation examination. And so that process allows us some measurable things that we can look at, but allowing the woman then to go, well, actually, we could do what the alternatives are. And so, yes, we could do an internal examination by palpation, but we could also do a visual examination. So by looking from the outside and palpating the sitting bones and observing the anatomy from the outside, there's a tick cross mechanism of looking at pelvic floor function. So you can ask a woman to contract their pelvic floor and let go, and what we'll see externally is visually moving of that perineum, which is the area between the vaginal opening and the back passage. And that really doesn't allow us to assess tone necessarily, or closure and some of the elements on the inside, but it gives us a basic understanding of correct technique, which can be a starting point for a woman who's feeling very vulnerable, or a woman who has perhaps never had this type of examination before, or they've got a history of pain. And then I guess a step back from there is we could fully clothed actually look at breath pattern, look at abdominal cavity, look at glutes, look at all those external things that we really don't want to see much activity there when someone's activating and relaxing their pelvic floor. So I think that education's so important, and I just, perhaps sometimes I go a bit overkill. But I just think that knowledge is so important, and in allowing a woman to have the autonomy to say that actually, no, this is not something I want to do, and that there are alternatives. So I think that first, and then second, doing a really thorough consent. And so, you're asking for full consent to do whatever type of, whether it's visual or internal palpation examination, and then looking for and asking a woman for, the term I use, is
oh, we've lost you.
Is there any reason that an internal or this type of examination? Oh, can you hear me? Have you got me now?
Yeah.
Can you hear me now?
Yeah. Can you?
Okay. So asking that the wording I use around looking for clues or signs of past history of trauma and abuse, might sound like, is there any reason that an examination might cause you some emotional distress, which gives them opportunity to allow that information to be shared. Asking for allergies to latex or lubricating gel, and asking for a chaperone or someone else in the room for the examination. So that's really important. Obviously, full stop, it's important, especially in the world that we are in right now. And then you would allow that examination to happen. Sorry, and then that's where I think, Alicia, you'd already spoken about.
Well, I said have a good chat, so that's what I meant.
A good old chat.
Yeah. But thank you, Kaz, for clarifying that. That's important. And also, just in terms of that, have you had any experiences that would make this type of examination uncomfortable? Quite commonly, they actually talk about a traumatic pap smear.
Yes, they do.
Quite common, often, sometimes there's also, unfortunately, some abuse that they want to talk about, but quite often that abuse to some women is a traumatic pap smear.
I love that you've given them space to say that, because they may not have ever been asked that.
No, and I often get the reply, thank you so much for asking that.
Right. The two of you hearing is like, you're there for the client's best interest. The person that's right in front of you is who you're giving your all to. You're you're giving them education of this is what I'm doing. You're giving them empowerment that they can go, wow, I felt amazing after I've come out of there. And giving them support, giving them a place where they have a voice, because sometimes as women, we don't get a place to have a voice. And it's like, oh yeah, everyone has a baby, or everyone has a pap smear, whatever, where you've given them that opportunity to open up to you. And for them, they might have held it for years, and now you've given them that space. So thank you, ladies. It's lovely that you're in our lives too.
No, you're welcome. And sometimes too, that first appointment, you don't end up doing anything from an interview because they have identified things that they wanted to chat about first, and that's totally fine. We'll postpone the examination to next.
Yeah, I love that you've shared all of that information, and it actually helps put in perspective why it's so important that you can't just do Kegels after you've had a baby, even though it's just readily shared that, okay, you've had a baby, just do your Kegels. But it's like, okay, if you do need to do your Kegels, are you doing them correctly? And that's what you check. And then it's everyone has a different ratio of Kegels or routine. If they are to do Kegels, if they don't have a hypertonic pelvic floor, then they won't be doing Kegels. So I think that's really important. So you can't just do your Kegels.
And a lot of time people are doing Kegels wrong. And
exactly.
Again, we're
bearing
also
down.
at the traffic lights at what's the one at the traffic lights when you're sitting on the toilet is a huge one, and it's like, no, you don't do that. And then what's the third one?
I can't remember. I know what you mean.
I think it comes down to with when we're doing pelvic floor examination, you work out, okay, does this person lack strength, or do they lack endurance, or do they lack speed and coordination? So what you find there then determines what type of pelvic floor exercises they need to do. So, do they just need to train pure strength? And there's, physiological principles that you follow for muscle strength training that we extrapolate into the pelvic floor scenario. Whereas if someone's just lacking speed and coordination, the exercises you give those people may be a little bit differently. And different positions that you do them in. You can use positions to progress or change the exercise.
Yes, so like lying down, then you're progressing all the way through to standing, which is obviously a lot harder.
Yeah. And I think even the length of hold that you prescribe, it depends on what that woman can do initially.
Yeah, and then you actually alter your
very individual
prescription as well, as I have had it with Carolyn.
Yeah.
On that note, do you is this a faddy thing or not? Do you do a think of weights, as in you attach a weight to your pelvic floor? Is that a real thing, or is that just bullshit?
Yeah.
No, we had a good chat about that.
Do you want to answer that one, or I'm quite happy to? I've only sold my last one yesterday.
Oh my goodness, show me. I need to see what this is.
I can't hear you. We can't hear you, Karen. Oh, there
Oh
we
yeah, I
go.
can see. It's a thing then.
Yeah.
Yeah.
So vaginal weights can be used in the right population. So we don't advocate buying them online and anyone using them without proper instruction or examination assessment of the pelvic floor. But in the right setting, if you're trying to train someone or help her train her pelvic floor for strength, and she's got good technique, she's been able to build everything up, so she's doing all her exercises standing up, and you want to find another way of progressing, then you can use vaginal weights to place on the pelvic floor. So they're like a glorified tampon. That's what they're like a weighted tampon, but they're all different sizes.
So how do you use it? Yeah, how do you
Carolyn's
use
trying
it?
to say something.
I know, exactly. So you actually, where do you attach it? Like, how do you use it? Lying down or forward? Like...
So I wouldn't normally recommend lying down. So the idea of using weights is to progressively add resistance and load to the pelvic floor.
Yeah.
So if I recommend weights to anyone, it would be when they're doing all their exercises standing up, and easier when they're in the shower. So I get her to put her weight in when she's in the shower. It could be every day, it could be every second day. She might be in maintenance by then. And you wear it, you put it in like you would a tampon. So it sits above the pelvic floor.
Okay, so it's like a weighted tampon.
It's I wish I had one here. They're silicone. Now the ones we recommend are silicone. They are actually got a bit of width to them, because that's the other thing that we find women will buy weights online and they're really thin and they fall straight
I mean,
out.
I can't imagine me being able to do it with an avulsion, because things just drop out.
That's the thing. So that's why not everyone
exactly
will use them.
Yeah.
But if you've gauged the width of the weight and the width of the woman's hiatus or her opening size, they can be a good adjunct to pelvic floor strength training used in the right way. We don't want them to put them in and go and do the housework for the next couple of hours, because that will set up a quite a likely pelvic pain situation. But in the right person, they can be used quite well.
Yeah.
Oh, okay.
Do you want to add anything else, Kaz, to that?
I often recommend the shower too, because it's convenient. So, I think there's been a growing interest in using devices to train your pelvic floor. The one that a lot of people know about is the PeriFit. That's probably over people's news feeds, and you can connect it to an app on your phone, and people see this graph of when they contract and when they let go, and I guess there's a sense in which it motivates people. But the barrier to ever using something within the vagina is you've got to strip off and put something in there, and then and then still do it. So at least with showering, you're already undressed. So that's typically when I will suggest using them as well. Yeah.
How much do those PeriFits cost?
I think they're about $200.
$200.
Yeah. Yeah. And they're not cheap.
The PeriFit, sorry, just to explain, the PeriFit is not a vaginal weight. The PeriFit is EMG feedback. So it's another way of helping to train a good pelvic floor muscle contraction and allow some biofeedback about the progression, but it's not adding load or resistance.
Is that the one where you do a game as you do your
Did you see that?
Kegels? Just tie it in with something fun, hey?
Yeah. But you have to be careful. So we wouldn't give these to women who can't contract properly. Otherwise they can get too carried away playing the games.
That's right.
Yeah, and they'll forget about their technique, and they're trying
and they could then just use their glutes and adductors. Do you know what I mean? So you still have to ascertain correct function and technique first.
Can we go back to the pelvic floor examination? Say with me, when you've examined me, Leisha, we've less tension on one side to the other side. Again, obviously, I'm not the only person that has that, so with having internals is important for that, because we know that one side is different to the other side, that it's not just because it's I call it the sling,
Mhm.
that we can have different tensions. Do you want to explain a bit about that, or is there anything to add?
Are you referring to levator avulsions?
No, do you remember we were finding, well, Lara
For
has,
me it is.
or Lara, but then we felt my right side was weaker than my left side. I was giving more tension, and we might think it's from the trauma that I experienced, but obviously other women feel that too as well. That if I, say with training it, you could feel that I was lifting and contracting and relaxing the left side better than the right side. But with other women out there too, if they're going through any of that as well, that to explain that that's another important reason to do your internal examination, is to see how that is all in sync together. Do you know what I mean? Yes. Yeah.
I think for some reasons, one side of the pelvic floor might be overcompensating. And sometimes I've actually seen a few women who have not much function at all on one side, and the other side is actually quite tight and overactive and fatiguing. So it is very hard to then just do a very general strength training program for that, because you would be, making the overactive side worse. I think one thing that women can do is, if they feel comfortable, self-palpating. So, if they feel comfortable in the shower, putting one or two of their own fingers in the vagina, just for some biofeedback, and you can place your fingers on either side of the pelvic floor and try doing some squeezes and see what you feel, because that's the quickest and the cheapest form of biofeedback.
I think that's really important. I don't think many people would do that or think to do that, to learn about your own body.
And don't expect that it's going to be a really vice-like grip around the fingers. And also, if you only put one finger in right in the middle of the vagina, you may not feel much, because the vaginal muscles, you normally palpate, feel that contraction on the bottom half of the vaginal opening. So, but that technique alone can give you some really good learning information about what's happening with the pelvic floor.
Can you do a pelvic floor internal if you are pregnant? And is that important to check when you're pregnant?
I'll let Carolyn answer this one, because we've had a good discussion about this, Kaz, haven't we?
Pelvic floor physio. So firstly, we're both going to advocate that it's really important that every woman who is pregnant has some kind of education and understanding around their muscle function and control, and also looking for risk factors for longer term pelvic floor dysfunction. So I think pregnancy is a great opportunity for women to engage a pelvic floor physio. Your question was, can you do a pelvic floor examination on a pregnant woman? Alicia and I, where Alicia mentioned we'd had a good discussion about this, I wait until a woman has had her 20-week morphology scan before I'll do an internal examination of the pelvic floor. And Alicia will wait until after they've passed the first trimester. And they're sexually active and requesting that examination. Is that right, Alicia? So I think different pelvic.
Why at the 20-week mark?
Yeah. So having an internal examination, there's a very, very small.
Sorry, everyone. I'll pause when she's back. Beep. You'll have to just say that again, Carolyn. We just missed you.
Risk of infection, and a woman is sexually active, no bleeding.
Carolyn.
Yeah.
Sorry, you dropped out. Could you just say that again? Like, what's the reason you check pelvic floor
after.
check until 20 weeks.
So I personally wait till they've had that morphology scan and they know they've got a healthy pregnancy, because I would hate for, it's really for the woman's psychological state, that if heaven forbid, the pregnancy doesn't end up being a viable pregnancy, I don't want that woman to then reflect and go, oh, if I hadn't have had that examination, maybe this wouldn't have occurred. And, not that I think the vaginal examination would be a causative factor in that process, but it's part of that psychological understanding. Having said that, having an internal examination carries a very small risk of infection, and it is very small. So that's my personal preference. But I think, as Alicia, and we've had this discussion, has shared, that if a woman's sexually active during her pregnancy and there hasn't been any fluid or bleeding loss to suggest that there might be, a bit of incompetence of the cervix or other risk factors, then, that Alicia's will do that examination after she's passed that first trimester, knowing that there's a viable pregnancy.
I think it depends on the indications too. So
Yeah,
if the woman just has no idea about a pelvic floor contraction, and all she wants to know is, am I contracting my pelvic floor properly? You can do that either externally or with a very superficial internal examination, which, I don't go anywhere near the cervix. It's just really the level of the pelvic floor muscles. So I think you have to take into consideration all those different factors, what the woman's after, and how comfortable. I think you just weigh it all up at the same time.
And then, like, say, before you ever have kids, would it be a good thing to see a women's health physio before you have children, like just to know what everything is happening inside? Do you think, you hear a lot of people saying, I just couldn't let go when I went into labor? Would that be due to hypertonic pelvic floor, weak pelvic floor? Would there be anything related, or?
That's a good question. Again, I think it comes down if you've got any symptoms. I think if there's any pelvic floor symptoms and you haven't been pregnant, it's worth investigations.
Yeah.
So now, it could be a GP visit first. It could be a pelvic floor examination. If it's just a general checkup, I think it's good to know what your pelvic floor is like. Is it hypertonic? Is it perfectly normal strength, but your control of the pelvic floor is lacking? That's always an area that is important before having kids. In terms of your question about leading into labour, we know that a good, strong pelvic floor that you have good control of will also allow better control of relaxation during labour as well. So if you've been told that you have a weak pelvic floor in pregnancy and are given strength training exercises by a pelvic floor physiotherapist, a lot of women say, well, I don't want to make myself too tight because that might impede the delivery. And
that's what I was concerned about with my second.
But if you appropriately train your pelvic floor muscles for strength, you also improve your control and your awareness.
Yeah.
And part of strength training, Carol and I are very fussy on the let go phase.
Yeah, the relax.
So I often say your let go is just as important as your squeeze.
Yeah.
So it shouldn't be a reason to not do them. Because you're scared that you're going to be too tight to deliver.
But I think a lot of people don't let go, because even with me, you were like, basically bear down, Now I bring that onto my clients, always contract, but make sure you let it go. This thing Frozen. Let it go, let it go. But sorry, I don't have a day job at singing. But yeah, a lot of people forget about the let go. They're contracting, and like I was like that after I had my first, because it was like, just make sure you do your Kegels, and I didn't even know what I was doing, So there's so many people out there that don't realize by letting it go, is just as important as contracting as well.
I think because you're worried, because we both have had pelvic floor concerns and issues, you worry about letting go and bearing down, because what if everything just falls out?
Exactly.
And that's something you have to then train as well.
Yeah.
Sorry, Kaz.
I was just going to say, in answer, like I guess an extension of what you said, Alicia, about preconception engaging a pelvic floor physio. Like, what are the symptoms, right? So, you know, if ever there is any urinary leakage, that is not normal. If ever there is any leakage from the back passage, or an inability to hold wind, or a difficulty emptying your bowels,
Or bladder.
again, not, although very common, not normal. A sensation of pain, an inability to use tampons, or pain with intercourse, again, common, not normal. Sensation
What
of
about
heat.
rush-
Sorry?
what about having to rush to the toilet? Is that another thing where you
Urgency. So an inability to, so the definition of urgency is an overwhelming desire to do a wee that's difficult to defer. Now, the definition of urgency has not changed for a number of years, and Alicia and I listened to a very well-versed physio who's done lots of research into bladder urgency. And again, sometimes urgency is warranted. So if you've got this really full bladder and you'd been holding on for 4 or 5 hours, that's not what we're talking about. It's the first desire to do a wee that is overwhelming and difficult to defer. So that, again, is something that we would want to engage or educate and understand what's going on. And I guess the other thing is there are genetic risk factors. So if you've got a mother, an auntie, a sister who has prolapse or has a history of urinary leakage or bladder or bowel dysfunction, that might be another reason. Or if you're a child who perhaps was a bedwetter until you know, your early teenage years, or you have giggle incontinence, which is often linked to overactive bladder. But so they're the types of things that it can be quite useful for you to engage a pelvic floor physio before conceiving. Some women, you know, it can be a good opportunity just to understand, because there's so much that you don't know until you know it, if that makes sense.
Yeah. Thank you for that. Thank you for clarifying, because those symptoms are important for people to understand if they need to see someone. And it's also good to understand your own pelvic floor first, because there's so many changes that happen when you've had a baby and then you've given birth as well. I think that's why it's important, even if you've had a vaginal birth or a C-section, you've still carried that baby. And there's so many people still believing that you don't need to get a pelvic floor check because I've had a C-section. So
but they don't offer it. When I had my C-section, I asked, because I was being a bit of a pain, can I see a woman's health or pelvic floor?
No, you weren't being a pain, Mags. You were advocating for yourself.
And I was told I don't need to see one, and I said yes, I do. And they're like, no, you don't.
But
and
they
I
don't
said,
offer it with vaginal either, unless you've had a third or a fourth degree tear.
Yeah. But yeah, I said to her that I've had a 4.5 kg baby, so I need to see one. And then, God bless her heart, she was a young girl, and she came in and she was like, oh, you're too sensitive down there to do one. And I goes, I had a C-section. So, but then I booked in and I seen Alicia, and Alicia sorted me out. But I felt sorry for her because, like, there was no internal examination, nothing. But I was just being a twig. Like, I purposely asked and I wanted to hear what their answer was, and not, you've had a C-section. But eventually they got me to see her, which was amazing. but how many other people are out there, as Lara said, after having a natural birth, no offer whatsoever. Like, it's terrible, I personally feel. Yeah. But again, like when I had my first, all the trauma I went through, I had the 4th-degree tear, Carolyn, and loads of stuff happened afterwards. But like, a women's health physio came in to see me in the hospital. Now, this was in New Zealand, and I was so off my head in drugs. I had lost lots of blood, so that I didn't even know where I was, to be honest. And she came in, and I had muscle separation, never knew how much I had. And we spoke about the pelvic floor, but I had no clue whatsoever. And then I remember she gave me the tubular bandage to put over my stomach, and I was like, oh yeah, I'll do this. No clue whatsoever. And no clue afterwards of a follow-up of a women's health physio. Didn't see one women's health physio in New Zealand. I ended up going on having my surgery in New Zealand. Never recommended after having the TVT sling inserted, of how important you guys are. Still leaking after having my surgery, and all the urologist said was like, do your Kegels. But sure, I didn't know what Kegels were properly. And then I moved to back to Australia. Then I did my own research to figure out, because I just lost my whole body basically. But how many more women are out there are in my position? And you know, it's so important that, you know, we can see it. We all want to empower these women, want to support them, give them the education. This isn't normal, you know. And you know, having a new baby, for me, that 12 months was taken away from me, because I gave so much time in and out of hospital. How many other women are in that position, you know? And you know how important you are to women. It's like, it should be shouted from the rooftops, you know what I mean? But it's kind of a taboo. And then, you know, we spoke about earlier, I finally found I taught a women's health physio, and I went to see her, but she did no internal examination on me. And then I was told how to contract my pelvic floor by squeezing my glutes. And I was lost, because I was still leaking. Do you want to go into a bit of that, like about a women's health physio that doesn't do an internal examination?
And is that still okay? Because obviously some people they can't just do an internal, they're just not ready.
Yeah.
I'm so sorry that was your experience, Mags. That's unfortunately, it's not uncommon, but it's every time I hear these stories, I feel so deeply for you, because you're so vulnerable, and you don't know what's normal. And as I said, you don't know what you don't know until you know it. And so now that you know it, I love that your passion in wanting to, you know, other people to know what you know, because that's how we feel. we know that we can help people and change I often get asked, why did I do this area of physio? Because do you want to stick your finger in there? And I just go, if only you were in the room with these women who want to come in and hug you because they're not leaking anymore, or they can have sex with their husband and it's not painful, or they can conceive to have a baby. It's just, you change someone's quality of life in a way that is so deeply personal that they feel entirely vulnerable to share, even with their closest friends. Like, that's why we do what we do. So I said that because I just thank you for sharing that, and I'm sorry that was your experience, and I'm sorry that your experience of seeing a women's health physio was someone who perhaps at that time didn't give you the education that you needed. And I guess as physios, we are taught to practice within our scope of practice. And so in our career, we can, you know, as a physio, you graduate, and I always, you know, just think, gosh, you're just taught to start to scratch the surface of dealing with people and trying to build up an assessment toolkit and a treatment toolkit, and it's so important across any profession, but you know, especially obviously in physio, that you continue to grow in your own professional development through doing courses, and whether you go on to do a master's or you find the area that is lights your fire and what you want to continue to do. So in all that being said, everyone in their career is on their own journey of accreditation. And so that physio that you saw wasn't accredited, wasn't able to provide that internal examination. So I guess if your listeners take anything away from this, that to examine pelvic floor muscles, to be able to ascertain their ability to contract, relax, but also grade elements of that muscle function, you need the internal examination. And so being able to see a physio who has done that pathway to be able to do that examination is really important. Do you have something to add to that, Alicia?
I think that's very nicely,
Yeah.
very nicely said, because there are so many physios out there that Kaz, you and I still collaborate with.
Yeah.
And not share clients, but we all want to be able to help this one woman, and we all have our specialties and we all have our areas of expertise. So we are very interested in the pelvic floor, but there are other physios out there that have other specialties that can help you in other areas, and PTs as well. More taking all the education from the pelvic floor and extrapolating it into general exercise classes and function, and that's important.
Yeah, and for us as PTs, you get women that come to you and they open up like they do for you guys, and just being able to support that person, and not make it normal, because you do see in the big world of lifting weights and wetting yourself, and it's a kind of a show thing where it's like, no, darling, that's not normal. You don't need to wet yourself doing that. You know what I mean? And just giving them that support that from everything, we can build you strong. You know what I mean? Yeah,
absolutely.
That's a good one actually to lead into, just conscious of time, when it comes to the 6-week checkup. Like, what's the reason behind 6 weeks? And is it important to still go and get a GP check? Because for me personally, I just go straight to you guys. That's what I did, because I wanted to know about ab separation, pelvic floor, and my GP didn't do any of that.
I know you've got something prepared, Carolyn. That's why I'm looking.
I can always talk, you know me. So you start.
I think at 6 weeks, it's, say if you've had stitches or something like that, they are likely to have healed by 6 weeks generally, but very superficial healing. There's also discussion about contraception. So, should you see your GP? We can't replace that at all, because it's important discussions to have with your GP around that time. But it's not the time when we can say at 6 weeks you are ready to go back to normal life or normal forms of exercise, because we know from a tissue healing and tissue recovery point of view, it's closer to 3 to even 6 months before tissue function is back to normal, and that's if you followed the right recovery process.
Okay.
So I think from my point of view, Carolyn, you can add some more, but I think the 6-week check is still an important check, but it's not the check to actually get the tick off, the clearance from a pelvic floor point of view. I think that needs to happen at the same time, and then probably another one down the track before going back to high impact exercise and things like that.
Definitely. I mean, go for it, Carolyn.
I think it comes back to education, doesn't it? So the reason why there's that medical 6-week check is that it takes 6 weeks for that uterus to contract back down into the pelvis. women should have ceased bleeding by that stage. And from a it's physiology, right? So you would expect that, as Alicia said, that superficial scar tissue, stitches to have been either absorbed or dissolved, or what's on the outside drop off. And so from a medical standpoint, they need to ascertain, has the woman finished bleeding and is it normal? Because obviously there's quite, there are risks if a woman has some retained placenta, or there's signs of infection. There's all these normal processes that we should expect to have happened by that line in the sand of 6 weeks. So from a medical standpoint, that's an important check. It's also an opportunity for the doctor to connect with the mum and the baby, because commonly if there'll be a discussion, as Alicia mentioned, around contraception. Like a woman often feels like they go to that appointment, they're given or what are you doing for protection and contraception, and how's the baby? And technically they're checking for signs of postpartum depression, and it feels like depending on your doctor, sometimes it can feel like a rushed appointment, because there's lots of things to cover. So I guess what Alicia and I would like to differentiate is that a pelvic floor check or an assessment with a pelvic floor physio can be done at any time frame. And in fact, we can see women before that 6 weeks to look at abdominals, to look at perineal swelling and how to manage that swelling. And if they're already having early signs of prolapse, what can they do to manage that in those very vulnerable early weeks?
When you saw me, I had you stuck me in a tubie grip bra even before 6 weeks. I was like 2 weeks postpartum. I was like, this is fit.
It suited her.
Breasts and mastitis and feeding and postural pain. And so it's not just about the pelvic floor. And yeah, carpal tunnel, Alicia's pointing to her wrist, or de Quervain veins, like the mum's thumbs. There's lots of things that we can assist with. So I think I want to differentiate that there's that medical assessment that is very different to what we do.
And I think it is important, though, I believe, and Mags, I'm sure, because you are told at the GPs, okay, because you're asked, like, can I go and exercise now? They would say, yeah, I don't see why not. Okay, but what do you exercise? You've got a new body now. And I think mums don't realize how new their body is and why it is so important to still get checked with you guys, and then work with a PT who specializes in working with women who understand pelvic floor issues, and don't just go back into classes doing box jumps and trying to get your body back. It's just it makes us cringe.
And I suppose you see a lot of people that go back into it, and I say this in a nice way, with a strong body, and then 12 weeks of doing this, crazy exercise, and then they end up, and it happened to myself, you end up with wider muscle separation because you're doing exercises that are making those abs go wider and wider that you don't realize. You are getting leakage then, because the pelvic floor might have been at a weak point, but it wasn't leaking at your 6 weeks. But then 12 weeks later, you're leaking more. Then, you could have bowel problems. There's loads of things that people go, oh shit, I was fine after having the baby.
Just don't know, do
but
they?
They've no idea that if they got that sorted, then not sorted, but strengthened and built them, as I always say, built their foundation and then gave them the wings to spread, they'd be flying it. But a lot of people go backwards. They go out, they smash their bodies because that's what society is telling us. We'll go on our phones now and everything will be 6 weeks. You can go
6 week challenge, get the body back.
And that's what happens. And then everyone does it because it's society. It puts that pressure on us. And even after I had my baby just there, well, he's nearly 12 months, people would come up to me like, you were definitely only belly. And I was just like, yes, I know. And I don't like looking at it, you know.
Yeah.
And it's like, you know, they're giving me a compliment, but I'm kind of like, yes, I know. And, you know, I'm trying to get rid of this now. Do you know what I mean? Because you are, all that you're looking at is there. And like, then that people, it gets into your head, because you're like, everyone's looking at me now, just looking at the belly. And then you'll stand like this, so you'll stand like this, that no one can look at that. And I'm not the only one. There's so many women out there that feel that way as well. And that's the way society's putting it. And it's all that pressure of get our bodies back. But yeah, I find, you know, their bodies might be that wee bit weak, but then they go and not that they trash it. What word can I use? Like
some do though.
Yeah.
I mean, but doing the
Yeah.
exercises that aren't correct for their body after having a baby.
Yeah.
I think the other thing, when you're a new mum, you've also got the hormonal impact that's still happening, especially if you're breastfeeding, you haven't had periods back for a while. Sleep deprivation. It can also increase your risk of more damage or more trauma. So being really careful in those periods of time too. Being careful of your boobs too. So
Tubie grip doesn't help if you're doing box jumps.
And you need often two pairs. That I've always said you often need your maternity bra and then your sports bra.
Yeah, you got 3 on.
Because your breast tissue is so sensitive and your boobs are so much bigger at that time too. You don't want to go bouncing them up and down and causing another issue. Yeah.
And I think like another thing that was pushed for, and it's for ABSEP and the C-section scar, is the compression tights. Some of them can be so tight that you can't breathe in them. But like, I remember I put on my first pair, I was literally sitting like this because I was so uncomfortable. And my husband's like, I don't think that's a good idea.
Not a wetsuit, isn't it?
I'm doing it, but again, that's what I was being told: get it on as much as you can. And some days I was sitting there going, I can't breathe. So I suppose what I learned from that was like, you know, we don't need to push ourselves into that position, should we really? You know, like, are we at such a risk if we don't have it that tubed together? No.
I think they should be making you feel more comfortable.
Yeah.
They shouldn't be making you feel uncomfortable.
I'm so dramatic.
It doesn't mean that if you have them on that you can go and do whatever you like.
Yeah.
But they should be there to add support, add proprioception or awareness to your body, but still exercising within the limits of what your body can do.
On that note, is there anything that you want to add, Carolyn, as we wrap up?
I think we need to do a second podcast because we've got some more questions to do.
Yeah.
Because I'd love for Carolyn to get more into, well, both of you guys, into the carpal tunnel. Like, there's so much more. Prolapses, everything. I think, you know, we could do another one if you're keen. I've really enjoyed doing this with you guys. Yeah.
It's not just about pelvic floor, because like I had a woman only this week that had the mechanical type of leakage, so stress urinary incontinence, and she only had it with sprinting and kicking a ball. And she thought, you know, her pelvic floor must be really weak, really weak. And in fact, it wasn't hypertonic either. So it wasn't that that was the cause. She was actually really strong. And this is where then I kind of thought we have to look more broadly. And she still had quite a wide diastasis up at her sternum. And I often see women, you know, 10, 15 years down the track, and they think, why is she assessing my tummy muscles? You know, commonly I'll still see that rib flaring pattern and wider diastasis of their tummy muscles. And then you need to look at, you know, like their deep hip rotators and their glute strength and their coordination of their core connection. So, you know, it's we don't just do pelvic floor, I guess, and you've talked about de Quervain's and carpal tunnel and things like that. So we're using all of our physio skill set to kind of look at all of these things. And it does start, you know, we often use the language that it's pelvic floor and core first, and then we work out from there. And, you know, you really want to understand that muscle function so then you can appropriately do everything else.
And also work with the woman to try to reach whatever goal she's aiming for.
Yeah. Yep. Yeah.
City to Bay. It could be wanting to run marathons. It could be that she to
CrossFit,
CrossFit, you know, and as pelvic floor physios, we don't say, oh, you should never do CrossFit or you should never be Pilates, but we need to make sure that your body's fit and strong and healthy to be able to do that safely.
I love that you've said that at the end, because I don't want ever mums to be told, oh, you've had a baby, this is just your body now, just good luck, you're not going to be strong anymore. You can be stronger postpartum.
Yeah.
And the benefits of exercise are so important for our mental health, our physical health, you know, diabetes, cardiovascular. So we can't cotton wool and say, look after your pelvic floor, see you later. We've got to, you know, try to get the pelvic floor in the best condition possible to do what we want to do, stay fit and healthy. Yes, there are certain situations where we might need a little bit of extra help to help support the pelvic floor, you know, pessaries and things like that. But, you know, it's all about trying to reach your goals and stay fit and healthy.
Lovely.
Love it.
Yeah, that's a good ending. And thank you so much.
Mm.
We really appreciate you taking the time.
Thank you for asking us.
Yeah,
It was fun.
good.
Yeah. It wasn't as nerve-wracking as I thought.
Good.
Good company, that's why.
If anyone still has questions, I'm sure these lovely ladies will happily answer them. If you want to drop us an email, it's realtalkformums@gmail.com. And thank you again.
Do you want to say where to find these?
Yeah, we're going to put it all in the links below for getting in touch with you too.
Wonderful.
Bye. Thank you.
See you, Kaz.